All right, let's talk about human needs assessment. Now, there are 8 human needs assessments we look at when we're making a dental hygiene diagnosis, and you can see them listed right here. This is from the Darby and Walsh textbook, and I can show you, make it smaller. It's from figure 22.2 on the 5th edition of the Darby and Walsh textbook. And so what I want to show you, let me make this bigger, is that there are 8 human needs assessment, and let's go over them. So the way this works is when you finish treatment with your client, when you finish the assessment period with your client, so you've gathered all their health history information, their medical history, their dental history, their social history, you have gathered the extraoral, intraoral assessment, you have done the perio assessment, you have done radiographs, you have done hard tissue charting. So you have all the assessment. Now we need to circle all the things you found from your assessment. So before we go over the different things that you could have possibly found with your client, let's go over the human needs assessment, the 8 different human needs assessment. Let's go over what they actually mean. So number 1 is protection from health risk. Protection from health risk is when you're free from any harm or danger. So when the client is free from any harm or danger. So if their blood pressure was too high, I would circle this, and that falls under protection from health risk because now they're at risk for high BP, which can lead to stroke, heart attacks, and so on. If they need pre-med, I would put them under protection from health risk category, that human needs assessment, because they need pre-med in order for them to be safe. They're at risk without taking pre-med, when they don't take pre-med. Potential for injury and risk factors. So let's look at risk factors first. If they are a smoker, if they are diabetic and it's uncontrolled, so if they're immunocompromised and it can affect their health, I would put that all under protection from health risk. You know, if they're smoking and they are at risk for cancer, right? Potential for cancer, potential for injury, anything that can harm themselves, you want to make sure you circle or you identify the needs under this human needs, which is protection from health risk. Okay, so your goal is to keep your client as healthy as possible. If there is anything that's preventing you from keeping your client as healthy as possible, we need to circle those. We need to identify this, and we're going to make a DHD. We're going to make a dental hygiene diagnosis using the unmet need under protection from health risk. What if your client is very fearful? And how can you notice? Well, when the client comes in, you can see that they're grabbing onto the dental chair really tightly. Every time you go close to them with an instrument, they're like winking, they're blinking, they're closing their eyes. They're, you can see that they're very nervous, and they might even tell you that they're anxious and nervous. Then this is the unmet human need, freedom from fear and stress. So they're anxious. And it doesn't even have to be anxiety. It could be other things such as oral habits. So that means like when they're nervous, they're biting on their nails, or they're biting on the end of a pencil. So what habits do they have that they use when they are fearful, when they are stressed? Substance abuse. Perhaps they're taking drugs. Perhaps they're, drinking a lot of alcohol. Anything that they're doing to compensate for their fear or stress. And it could even be concerns that they have about infection control. So they come into the office and they're really concerned about whether everything is sterile, whether everything is clean, disinfected, and they're asking you lots of questions about that. That's because they're scared. That's because they have fear or stress. They could be asking you a lot of questions about fluoride because they're really scared about fluoride toxicity. Amalgam fillings, they may be adamant against it because they have this issue, or they have this fear of mercury toxicity. And so there's many different things that a client could tell you that they're really scared about, they're really concerned about. And if they are, this is their unmet human need. And anytime they tell you something, we need to resolve that. So first we got to identify what their needs are, what their deficits are, and then we're going to later on find a way to help work around this deficit. Okay, so protection from health risk, we want them as healthy as possible. Freedom from fear and stress, we want them free from any fear or stress. Freedom from pain, we want them having no pain. So they could tell you that their TMJ, maybe like their TMJ is in pain. So when they're at night, they've got lots of pain in their face. Maybe they're extremely sensitive to debridement and they're anxious about that. Maybe they have a node, a really swollen lymph node on, on their head and neck region. And so that is something we need to address. So if they are in pain, we need to circle this, or we need to identify that this is the unmet human need and then identify what pain they have. Number 4, wholesome facial image. So if they're not happy about their image, their facial image, maybe they have crooked teeth, maybe they have stain in their teeth and they tell you that, maybe their gums are really inflamed and they don't like that, maybe they don't like their facial profile, and so maybe they need ortho to fix that facial profile because maybe they have a class 3 or occlusion. Maybe they tell you they have bad breath and they're worried about that. So all these things you need to circle because that falls under the unmet human need of wholesome facial image. They are not happy with the way they look. Maybe they need teeth whitening, they have yellow teeth, and so that's something we need to look at. So we have to, the reason why we're doing this, it's we're putting everything that they say and everything that we've seen over here so that when we make a care plan, when we make a treatment plan, we can address each and every problem that they have expressed or that we see. Okay, number 5, this is a big one. Skin and mucous membrane, integrity of the head and neck. So what this refers to is anything on the skin and anything on the mucous membrane. So mucous membrane, think of inside your mouth. Your buccal mucosa, your labial mucosa, your alveolar mucosa, your gums, your tongue, all that falls under here. So coating on tongue will fall under here. If you see an intraoral lesion that looks funny, you would put that under skin and mucus. If the gums are really swollen, if there is bleeding, if there is deep pockets, if there is cowls, if there is xerostomia, so they have a dry mouth, all that falls under skin and mucous membrane. So anything gingivitis, periodontitis, like all that falls under here. Biologically sound and functional dentition. So this is to do with teeth and only teeth. So if they say that they have difficulty chewing, that's a problem with their teeth. If they say that they have, if you see that they have overhangs, that's a problem here. If you see that they have cavities, so caries, teeth with signs of disease, so typically caries, that goes under here. If they have missing teeth is an issue because teeth can drift, teeth can, supra erupt. There's lots of things that can happen when someone has missing teeth, and it can really impact their way they eat, the way they talk sometimes, there's lots of different things that can happen, negative things that can happen. So we need to address any missing teeth besides wisdom teeth. If wisdom teeth can be extracted, but everything else, if there is missing, we need to address that. We need to get that replaced. If they say that they have dentures that don't fit right, again, it's impacting the way they won't be able to eat properly if they have ill-fitting dentures. It's impacting their dentition. Appliances, maybe they have an appliance in their mouth, like a retainer, for example, that's not fitting properly. If they have abrasion, erosion, diffraction, we need to address that. Perhaps they are, perhaps they have maybe they're vomiting a lot and it's causing erosion. Maybe they're aggressively toothbrushing and it's causing, some of these things. Maybe they're grinding like crazy and it's causing diffraction. Rampant caries, so they have cavities everywhere. Again, all this, anything teeth related, anything that you see that's happening on the teeth is biologically sound and functional dentition. Their teeth are not sound, and so we need to address that. Number 7, conceptualization and problem solving. So conceptualization and problem solving, this is when they have a question about anything dental hygiene related. And this is a question that, the general public would not know. So it could be a question about, is there a link between diabetes and periodontal disease? And they heard about it, but they're not sure, and they're asking you that question. That's a conceptualization and problem solving type of deficit. They have a knowledge deficit. They have this lack of knowledge in the link between diabetes and periodontal disease, and so that's something we're going to address. Or they say, I've heard of periodontitis, but I don't really know what that means. Well, that falls under here, conceptualization and problem solving. They've heard of periodontitis, they've heard of gingivitis, but they don't know what it means. So we're going to address that. And then number 8, responsibility for oral health. This is where you can tell that they're lacking in oral hygiene because you see lots of plaque. You see that they haven't gone for a dental visit in the past 2 years. So if they haven't seen a dentist regularly, they don't see a dentist regularly, they got lots of plaque and calculus, then you know they're not taking responsibility for their oral health. Okay, if you see the parent is not brushing their kids' teeth properly or taking them to a dentist often, then that's, they're not being responsible for their kids' oral health. So you need the client has to be responsible for their oral health, and if you see that they're not, then we need to circle one of these items, and we're going to address them. So let's recap. Human needs assessment. There are 8 of them. Protection from health risk. We want our client to be healthy, completely healthy. If they are not, we need to identify why they're not. Freedom from fear and stress. We want our clients to not be anxious, not be stressed, not be fearful when they're in the dental office. If they are, we're going to address it. Freedom from pain. We want our client free from pain. There should be no pain in their mouth. If they are, we're going to address it. Wholesome facial image. We want our client to be happy with the way they look, with their breath, with the way their facial profile is, with their gums, with their teeth. If they're not, we'll make suggestions on how they can improve. Skin and mucous membrane. We want everything inside their mouth to be healthy. We don't want any lesions, we don't want any swelling, we don't want any bleeding, we don't want any deep pockets, any cals, any dry mouth. If there is, we're going to address it. Biologically sound and functional dentition. We want their dentition, we want their teeth to be perfect. And if it's not, if we see some things that we can, help make suggestions to improve, we're going to address that. Conceptualization and problem solving. Our clients may have questions, and if they do, we're going to address them. And then lastly, responsibility for oral health. If we see that our client has lots of plaque and calculus, they're not taking a good care of their oral hygiene, they're not visiting the dentist regularly, we're going to address that. Once you do this, so once you've identified what their signs and symptoms are, and you could do this by circling. So I'll show you this. This is an example again from Darby and Walsh where they have circled the problems that the client has. Okay, so this client that they saw didn't have any health risk factors. They were not fearful. They had no pain, but they said that they don't like the way their teeth looks. Maybe they said they don't like the way their gums look because perhaps it's inflamed or perhaps there's recession and they're not happy about it. We saw that they have cal, we saw that they have dry mouth, we saw that they have cavities, we saw that they have questions about dental hygiene care or about oral disease, so maybe they have questions about periodontal disease, and we noticed that they haven't gone to see a dentist within the last 2 years. So that is why these have been circled. So once you identify the signs and symptoms, so all of these that are listed here are your signs and symptoms, okay? Signs and symptoms. Once you identify this, then you got to write out the dental hygiene diagnosis. So the way to do it is you list the unmet human need. So there's 8 unmet human needs that we saw, right? We saw before. These are the 8 unmet human needs. Protection from health risk, freedom from fear and stress, freedom from pain, wholesome facial image. You would write this. So this is the unmet human need. Then you will figure out the cause, the etiology, the due to. So why is this an unmet human need, and what signs and symptoms do you see that makes this an unmet human need? So we're going to go over some of them, and then we also come up with a goal. How can we address this unmet human need? So for example, wholesome facial image, you can see here that teeth is circled. So the signs and symptoms need to be brought over here because signs and symptoms go over here. Okay, and we usually say evidence by the signs and symptoms. So here we're noticing that we circled teeth. So this means that the client has said that they are self-conscious and bothered by the front teeth that are loose. So her front teeth are loose. Why is her front teeth loose? Well, because she has class 2 mobility and she also has a knowledge deficit. She doesn't know about periodontal disease. And she's wearing a barbell tongue ring, which can impact, maybe it's hitting on the front teeth, that's causing it to become even more loose, even more mobile. So the unmet human need is wholesome facial image due to So why is wholesome facial image an unmet human need? Well, because she has mobility on her front 2 teeth, and because she's got a barbell tongue ring that's probably knocking on that front 2 teeth. And how do you know? Where's the evidence? Well, it's evidenced by the client telling us that her front teeth are loose. So what can we do about this? Now, when you write a goal, it's really important to note 4 things. 4 things should always be listed in a goal. The first one is the client. So client's name, the subject, the client's name should always be there. The second thing is the verb and action. So an action needs to be taken place. So the client will verbalize, client will demonstrate, client will participate. It's something the client will do. So in this case, the verb is verbalize, the client will verbalize back. And then what do we want? So this is like, what is the criterion of measurement? What are we hoping for? Something tangible. But the client will verbalize an understanding of the etiology and progression of periodontal disease. So they'll understand periodontal disease. They'll know why they shouldn't wear the tongue ring, and they'll stop wearing the tongue ring. This is what we're hoping for. The client may not necessarily do it, but this is what we're hoping for. The client will discontinue wearing that tongue ring. And then, so we said the subject, the verb, the criteria, and lastly, the time dimension, the time, when, by end of treatment. So we're hoping by the end of treatment, client will agree to, client will do all these things. So 4 things need to be put into a goal, into a client goal. Let's look at the next one, skin and mucous membrane. So if we look over here, skin and mucous membrane, we have circled that this client has attachment loss, so CAL, and xerostomia. And we can make 2 different, goals under the skin and mucous membrane. Let's see what Darby and Walsh has done. So the unmet human need is skin and mucous membrane. What were the signs that we saw? Well, if we look over here, the signs and symptoms were attachment loss and xerostomia. So I think here all they've talked about is attachment loss. Xerostomia will be addressed elsewhere. So they've said here that they have attachment loss of 3 to 7 millimeters. Now, I'm simplifying this. We saw a lot more, but they haven't circled it. But there is a lot more there. This person has BI, bleeding index, deep, pockets of pores, 5 to 7 millimeter pockets. So there's lots of signs and evidence to show that skin and mucous membrane is unmet. Now, why? Why do you think all this is happening? Well, probably because they have lots of plaque and lots of calculus, and they're not brushing and flossing. So that is why all this is happening. So etiology is, well, why is it happening? What is causing us? The heavy plaque, it's the calculus, it's the lack of brushing and flossing that is causing all of these. That is causing recession, that is causing the bleeding index to be high, that is causing deep pockets, that is causing CALs. So how can we address it? What can we do? Remember, there's 4 things that need to be put into a goal. First one is the client, the subject. So the client will. What will the client do? The next thing is the verb, decrease BI. So we want them to decrease their bleeding index. We want them to decrease the pocket depth. We want them to stabilize the CAL. We don't want the CALs to get worse. We want them to see a periodontist. So these are things we want them to do. And then there's also time dimension. So time dimension is by when. So if you look at the first goal, there's multiple goals here. The first goal says the client will, so subject, decrease, verb, the bleeding index to less than 10%. So this is the criteria for measurement. By when? The time is by the periodontal re-eval appointment. So by the 4 to 6 week re-eval appointment, their bleeding index should have been decreased by 10%. So that's one goal. And all 4 criteria were put in: the subject, the verb, the criteria of measurement, which is 10%, less than 10%, and the time dimension. By when? By re-eval appointment. And you can see for all the other goals, all 4 components are listed. Let's do one more. Biologically sound and functional dentition. So if we look at biologically sound and functional dentition, we see that the teeth where the signs of disease have been circled. So likely this person has cavities. So we put down that they have cavities, because that is the sign and symptom. We know, we saw in their mouth evidence that they have cavities. And if you did a CAMBRA, if you did like a caries risk assessment, you will also notice that they're high risk, because if they have active caries, they're automatically high risk for caries. So what caused the cavities? Ideologies, what caused it? Well, what caused this was a knowledge deficit. So the client did not know about the caries process and how it happens, and all the adverse effects of the caries process. And also, more importantly, remember how we said this client has xerostomia? Well, dry mouth causes cavities. So xerostomia is also a possible reason for the active cavities. So what caused the what caused the cavities? What caused the caries? Well, ideology is what caused it. Why did it happen? She didn't know. There was a knowledge deficit on caries process. And also she has xerostomia, and xerostomia can cause caries. There's a link, right? When you have a dry mouth, you're more at risk for cavities. So what can we do when someone has active caries? What can we do? Well, we have to make a goal. So the client, which is the subject, will what? Will decrease high risk for dental caries. So we want their high risk to go to low risk. Okay, so if we have a criteria, we want the high risk to go to low risk. By when? The time, remember, by periodontal maintenance appointment. So in 3 months or in 4 months, we want the high risk to go to low risk. And the way to do this is the client has to see a dentist and get it fixed. We also, so another goal is the client, so that's the subject, will schedule, so that's the verb, we want them to schedule an appointment with the dentist for restorative needs, so to get all their cavities fixed. By when? By appointment 4. So by the 4th time we see them, appointment 4, we hope that the client would have got their caries restored. I know they've left conceptualization and problem solving blank, but let's just, go over this for practice. So we saw that this person has questions for us as hygienists, and perhaps their question was on periodontal disease. They really didn't know about periodontal disease. So what would we put over here? Unmet human need is conceptualization and problem solving. Their signs and symptoms could be, patient or client has a misconception about periodontal disease. So maybe they said something that didn't make sense. Maybe they said, I'm trying to think here. Maybe they said that they had recession because, trying to think here of a reason that doesn't make sense. So maybe they heard a myth that if you eat, so-and-so food, it causes recession. And they think that's why they got recession and not because they weren't brushing or flossing. Let's just hypothetically say. Well, then what you would put over here is you would say unmet human need of conceptualization and problem due to lack of knowledge or due to knowledge deficit, as evidenced by client's misconception about periodontal disease etiology, or client's misconception about recession etiology, or about the cause of recession. And then you would say the client will understand or will verbalize an understanding of the periodontal disease process, so that you can understand why. So you can explain to her why recession is happening. Or maybe she thinks the recession is happening because she's aggressively brushing her teeth. So the client will demonstrate, you can say the client will demonstrate correct modified Stillman technique of brushing with using a soft toothbrush by end of appointment 3, for example, or by end of treatment. So make sure you have a time dimension. So what I want you guys to get at is that when we're doing this, unmet human need is found from these over here. So everything that you have circled, anywhere you've circled, that's an unmet human need. So you need to pull down, put all those unmet human needs here. Then you got to write down their signs and symptoms. So everything that you've circled over here needs to be put in this column. And then you got to figure out, well, why? Why is this there? Like, what is causing these signs and symptoms? Knowledge deficit could be causing caries. Heavy plaque could be causing recession, pockets and cal. Mobility and knowledge deficit about periodontal disease, and her wearing a tongue ring is causing her front teeth to be mobile. So, and then once you've done all that, then you need to come up with a goal. And once you've done the goal, then you need to come up with interventions. What are you going to do about it? So if we look at, let's look at this one over here. The client's got, recession, deep pockets, cals, active period disease, right? Gingival inflammation. What are we going to do? I would hope we would do a full mouth debridement to decrease that. So we're going to give them phase 1 non-surgical periodontal therapy. We're also more important, yes, we're going to debride. That is extremely important, but what's also very important is the education component. So we're also going to teach them about periodontal disease. We're going to teach them about caries. So when you look at the dental hygiene interventions, they talk about everything they're going to do to help with this issue, because every problem needs to be addressed. I'm going to teach them about plaque and how this happens, and we're going to teach them how to properly brush and how to properly floss. We're going to teach them about what medication they're taking that's causing xerostomia and what they can do about it. We're going to give them fluoride, because fluoride will help them with their cavities. We're going to, give them a full mouth periodontal debridement. So non-surgical periodontal therapy. We're going to debride their full mouth. We're going to apply fluoride varnish because they're high risk for caries. We're going to collaborate with the dentist and the periodontist to address the cavities and their periodontal disease, the periodontitis. And we're going to see them at 4 to 6 weeks and hope that the bleeding index decreases, right? We're going to explain to them it's really important that you come every 3 months or every 4 months for periodontal maintenance and to see a dentist regularly. So all these interventions need to be met. Some things I notice actually when students are doing this is when they write down the dental hygiene interventions, be sure not to put the time. The time dimension is only put in the client goal. Time dimension is not applied in the interventions. Interventions, you're just saying what you are doing for each and every goal. So every goal should have an intervention. Every school does it differently, so follow your school method format on how to do it. But yeah, I hope this is somewhat helpful in understanding what the 8 different unmet human needs are and how to figure out what ideology means and what signs and symptoms mean and how to now write a goal. Remember, there's 4 things to look for: subject, verb, criteria, time. Okay, let me know if you have any questions in the comments. Good luck, guys.